Hi and welcome. This is week 2 of a check-in with Ewelina, myself from Canadian Mental Health and mental health educator, and I'm here with Jenny Lee Almeida, and she's also a mental health educator with CMHA Windsor-Essex. We're just doing a short check-in podcast and wanted to share some information of upcoming things that we're all doing at CMHA and providing some free trainings and some free webinars on different topics. Because next week is actually the 4th to the 10th is Mental Health Week. So we have a lot coming up we wanted to share, and just basically doing a quick check-in of how we're all doing. So hi, Jenny, how's it going?
Hi, I'm good. I was just trying to honestly think about what would we call a podcast. I thought of various names for the podcast. And hopefully our podcast will look 10 times better once we're able to get into the studio with MediaWorks. But for now, this is how it is. So we have to, anybody have any great ideas for a podcast title for mental health? Send us an
email. I agree, definitely. So it's like week 2 of, like today's April 24th, we did one last week. And the weeks are time's going by pretty fast. We've been pretty busy, and Jenny, I know you've been doing a lot of different webinars on different topics, and we've had some changes with services, and I love seeing how many new services are out there and changing the mode of delivery and things like that. So yeah, it's already Friday.
Absolutely, it's already Friday. So my week, just quickly summarize, we're trying our best to really offer free webinars that are relevant, that are useful for individuals right now. Really quickly, this week we had 2 webinars really focused on understanding our emotions, because I'll tell you, it's a roller coaster ride on understanding where the emotions are coming from, how do I acknowledge it, and how do I just, be okay with it, manage that distress. So we're able to tolerate it a little bit, because right now, it's scary. There's a lot of varying emotions that we're all experiencing to varying degrees based on individual circumstances.
Yeah, definitely agree. And it's interesting because sometimes we get feedback on these webinars we don't expect from people, and they have questions. So it is a great forum for people to come on and ask questions and just connect with us in some way, because it's open to the public, anyone can join, and we usually record the webinars afterwards and put them on our YouTube channel, so they're free to watch for anyone who would like to check them out later. And Jenny, for me, this week's it's been a bit of a blur. It's interesting because we've been doing a lot of work in front of our computers, and the weather hasn't been that great. So I'm finding, like, if I don't move my body as much, or if I don't get out as much, it feels a little bit more, feel the stress a little bit more in my body and things like that. So those are some of the things I was reflecting on today. But the weather seems to be improving, and I'm hoping to get out a little bit more. But I think, it's really important to get information out there to people, and I'm hoping that people are managing well, because there's a lot of different at home. Like I'm still seeing memes and posts of even moms who are like overwhelmed with the fact that their children are at home, or trying to manage work and trying to manage relationships, and people are always being challenged in different ways, and and some days are always better than others. That's the way it is, right?
You know what? And to be honest, I've never been one for like a lot of memes, but I will say that the more and more that weeks go by, I'm using it as that line of defense in regards to laughing. Like, laughing helps us relieve so much tension and stress we're carrying. So I am now purposely looking and scrolling and laughing at memes. And today, the best meme for me was, for the next couple of weeks, can I switch the individuals in my household so I can maybe live with someone else. And I just chuckled and laughed because, there are days where, in a household with my husband and my daughter, and some days I'm human. I just miss my work. I miss being around my friends and colleagues, and yeah.
Mm-hmm. I agree. I miss being at the office, which I wouldn't think I, would say.
It's
But,
true. It's true,
yeah.
right? But so yeah, I've been using laughter more this week
Mm-hmm.
to just lighten that tension, that stress. And it's, what we spoke about this week in that webinar, understanding our emotions. The biggest part of building our emotional intelligence is really just being intentional, being mindful, and being self-aware of when you are feeling that emotion. Like, acknowledge it, name it. Be mindful of what behaviors do you find come after that emotion. And
Mm-hmm.
I love doing webinars and I love presenting, because it's almost like every week that I do a topic, I am taking all those strategies and, I'm also using them.
Yes, exactly. And one of the things you mentioned, like sometimes when we're recording webinars or doing these things, like there might be some interruptions, there might be something that occurs and that we can't control all the time, right? So it's just kind of being able to go with the flow a little bit more, and not have such hard expectations on ourselves and others, because things happen. There's life going on around us all the time, right? So especially for those that live with others, I understand that there's people that are living alone as well. So I mean, we've been kind of promoting the Keep Connected hashtag and all those resources about social connectedness online, through phone, checking with people. And I think that's really, really been a wonderful help for a lot of people, just to be able to be mindful in terms of checking in with someone else, and having those conversations and not feeling so alone, and being honest about how they're feeling, right? So yeah, so it's another week. We made it.
Which is the theme, right, for Mental Health Week. It's, let's really talk about how we're really feeling. It's breaking down those barriers. Like, there's been so many times that we ask one another, how you doing? I'm good, I'm fine. Some days I truly am, I'm good. But what if there's days when I am saying that and I'm not really okay? How do we break down those barriers, and how do we start to talk about it openly? So that's what Ewelina and I are actually going to work on and focus for Mental Health Week. We really want to have some webinars that are really dedicated more for an interactive discussion forum based. We want to hear from individuals in our community, what you're doing, how you're doing. When someone is telling you I'm okay and they're not, how do you investigate? How do you explore to get to that true meaning?
Yeah, and a lot of the time it's hard in ourselves, and that's where understanding emotions comes in, and self-reflection is, if you do say you're fine, like, but what am I really feeling? How do I get in touch with my own true feelings about, am I fine or is something off? But like, it takes a lot of work and a lot of insight into ourselves, right, and our emotions.
And the difficult part is, with COVID-19, I would like to consider myself someone that I'm very in tune with my emotions, but I will be honest, there have been times where, let's say, I have shown irritability or anger, and my husband might have said, "Oh, how you doing? You seem a little tense." And it was only afterwards, trying to reflect, scratching my head, like, oh, I don't know why I was irritated. Let me think. Right? Because our emotions really are, they're coming out a little bit more because we are experiencing, changes in our routine and trying to like adjust and be flexible and all of that.
No, I know, and exactly, and sometimes things happen that like not aligned with our expectations of ourselves or others, and then that can be very stressful, right? And if it's a day after day, it's just like, you know, it's hard, it's a lot, because we're just trying to do our best and, you know, cope ourselves. So yeah, and I think everybody's in it together in these terms, and I think everyone's just trying to make the most of it and turn things around and try to focus on the positives and on the things they're grateful for and on the things that did go well during the day, right? Because you know, we can really spend a lot of time ruminating on things that didn't. So yeah, this is all about getting real about, you know, how we're really feeling, saying I'm fine, but like really checking in with ourselves, making sure we take the time to do that, and I, like you said, opening it up to not just a webinar, but like a discussion with others that they can join in with us and ask questions. We could or just give them a platform and a forum to just discuss what we're doing right now. We're basically privileged because we can kind of check in with each other and share this information, but like there's so many people that maybe want the same kind of opportunity to be able to actually talk about what is actually happening, because it's hard to figure out how to get it out there sometimes, right?
So, I'm just going to share my screen with you because I forgot to mention something as well. So what we're also going to be doing starting in May is living life to the full. It is an 8-week, 90-minute skill building sessions. And really each session, Ewelina and I will be co-facilitating it. And you know, Living Life to the Full is a program from the UK developed by Dr. Chris Williams. CMHA-WECB brought it, and now, right, we got the approval to be able to run these courses via Zoom. So for anyone that is interested, please don't hesitate. You know, I know that we are all, it might feel like we're all getting inundated with maybe a plethora of resources and here, go here, go here. And it's hard to keep track of, and Ewelina is going to actually discuss some current navigating the mental health system here in Windsor really quickly. But Living Life to the Full program, it really focuses on connecting with others, learning skills to help you tackle life's problems. So if you're interested, please feel free, look on our website under events. We have 2 cohorts. Everything will be mailed to you in terms of workbooks. And so we have one cohort starting May 5th, 11:30 a.m. to 1 p.m. weekly. And then the next cohort will start on Wednesdays, May 6th. And then every Wednesday, 3:30 to 5 p.m.
Thanks, Jenny.
Yeah.
So I'll just quickly share my screen. Later today, we're going to have a webinar navigating mental health supports. So I'm just going to do a quick introduction of a couple new mental health supports in locally that you may be aware of. And we're also going to post our webinar on YouTube. So please check that out. It'll be on the same page as this podcast is on. So basically, if anyone is experiencing an emergency, so acute suicidal thoughts, self-harming behavior, substance-related intoxication, psychosis, severe alcohol dependence, urgent medical needs, aggressive violence towards others or yourself, please go to the ER. That's still the case. But also CMHA partnered with Hotel de Grace Hospital has opened up a mental health and addictions urgent care center. So, you know, same as physical health, sometimes you need to go to the emergency for your physical health. Sometimes you go to an urgent care clinic. So just look at it that way. So if it's something, a need that's urgent and not an emergency, you can go to CMHA at 1400 Windsor Avenue. These are the hours, and please, it's walk-in. And obviously there would be a screening at the beginning to see, you know, if you're having any symptoms, but there's also primary care there, and you will be hooked up with a social worker, addictions counselor, nurse practitioner, physician, or psychiatrist, depending on your needs. Also, there's still the crisis line. If you don't feel comfortable coming into the urgent care, the crisis mental wellness center is at 744 Follette. Their hours are still operational, 8 a.m., 8 p.m., 7 days a week. And obviously the crisis line number is 24/7, answered by a social worker. If you are in crisis, you want to call, you can't get out there, please still use that number. If you are experiencing a mental health crisis of any sort. The other newer non-emergency counseling service that is offered through telephone is the Windsor-Essex Counseling Support Line, also available 24/7. These are the numbers. It's 7 days a week, and it's just for now. I don't know how long this, I mean, hopefully this is a long-term thing, but definitely as long as people are experiencing policies where we have to socially distance ourselves, this is something that's available, and it is a counseling support line. So if you're not in crisis, but you need to talk to someone, a counselor will answer that phone and be able to provide you with some support. So just wanted to introduce those few things. And like I said, we are doing webinars shortly, so those things will be shared as well.
Thanks,
yeah,
that's
basically what I want to talk about. Yeah.
No, thank you so much, because what I've, been noticing online a lot is this week, I don't know why, but the focus this week that I've seen on Twitter are, a lot of advocates and individuals tweeting, basically just reminding individuals like, please remember that if you do need to go to the ER, you're still supposed to go to the ER if you are, you have a medical emergency. And it scares me, because what's going on with all those individuals that might need urgent medical care, physical or mental, but because we have been told, hey, if it's not an emergency, stay home. I just want everyone to acknowledge, like, if you feel that you're in an emergency situation, medically, mentally, like, please reach out, right? Like, there are individuals out there ready to assist, because I'm just scared that individuals aren't reaching out as much because, or they're maybe fearful to go to the ER. What are your thoughts have been, Ewelina?
Yeah, I definitely agree. I think, I don't know the stats on how many visits there have been at a year, but I have heard anecdotal information that there has been not as many, and that could be for many reasons, but I don't know exactly why. But definitely, yeah, you can still call 911 and get an ambulance. Like, frontline workers are out there every single day, so I would just not forget those services are there and absolutely available, and they will take all the precautions necessary to ensure that the person is safe and is getting the care they need. So absolutely, Jenny, I think thank you for bringing that up. Yeah.
Well, we're gonna try to make this
a bit shorter
podcast a little bit shorter, just because you might not want to hear us speaking for an hour. But last week we had a lot to say, and this week we will be doing a webinar in an hour about the navigating all those supports. So stay tuned for another check-in once a week with Ewelina and I. And, don't hesitate if you have any questions, if you, think of a topic, if you're looking for resources, we have a mental health promotion email. So it's just mhp@CMHA-WECB.on.ca.
Yes, Jenny, and I also want to mention all our events, all the information we have is on our website, Windsor-Essex.CMHA.ca. If you Google Windsor CMHA, our branch will pop up, and under events, we have all our upcoming webinars. You can just click on it, and you can register for the webinar by clicking on the registrant, and then you put your information in and you register. So all these are free of charge. Just register, you get an email, and you get the invite for Zoom. You just need internet access and a microphone and video if you'd like to participate. So yeah, that's how you get a hold of us.
Thank you. Well, thanks for the check-in again, and I guess I shall see you for our webinar.
Yes, I'll see you then, Jenny. Thank you all for watching.
Yes,
take care.
Bye.
Bye-bye.